Welcome to CareHero Podcast, where our mission is to educate, motivate, and inspire nurses and other healthcare professionals. In each episode, we explore how our guests successfully advance their careers and improve the lives of their patients and residents. We share practical tips and success stories to illustrate how you, our care heroes, can grow in your own personal and professional lives.
Welcome, Care Heroes. We're your hosts, Martin Hoy.
And I'm Gerard Hernandez.
We've got a really exciting episode for our listeners today. Isn't the guest someone that you know, Gerard?
Yes, Martin. Today's guest is someone who I've had the pleasure of working with. I'm very excited to have her today. Her name is Guadalupe Ojeda, but she goes by Lupe. One thing our Care Heroes will get from listening to Lupe is how passionate she is for healthcare, which I'm sure our fellow Care Hero listeners hear as well. You know, you can really hear it from her voice.
That's right. Lupe has so many great nuggets of wisdom to share to our listeners today, including, the value of continuing one's education, how to start getting into management roles, and how everything sort of falls into place when you're laser focused on ethical, quality patient care. All right, let's do this, Gerard.
And we have here Guadalupe Ojeda, Chief Nursing Officer of LA Downtown Medical Center, a 234-bed acute care hospital over 2 campuses in Los Angeles County, California. Lupe, welcome to the show.
Thank you, Gerard.
And Martin and I are so very excited for you to be here and for you to impart your words of wisdom to our Care Heroes audience.
That's right. You're one of Care Hero Podcast's first guests, and we're so happy you've joined us today.
Thank you. I'm very honored.
All of our Care Heroes, including yourself, are superheroes. But if you had to choose one superpower, what would that be and why?
I think that is a very difficult question because nurses have a lot of superpowers, but I think the one that I would choose for me, if I can have it, would be the gift of healing or the gift of listening. I'm not sure if they go together, or how you would put them, but I think that healing and listening are pretty much the same. I think that a patient's well-being depends on how well they are connected to their nursing and care team. I think that a patient's physical, mental, emotional, even their psychological well-being depends on how well the nurse connects with them. And I think that a nurse with healing power would connect very great with a patient, assisting them to potentially heal faster. They would be more compliant. They would learn more and get more out of the education that we give them at the bedside. So I think that by listening, you can really grant the patient the gift, your superpower of healing, because that's what it's all about. A patient comes to us and puts their total and complete trust in our hands, and we have the superpower and ability to assist them in their journey for good health. A nurse's superpower really is the ability to assist the patient to heal. So I think patient healing takes different forms, and the patient's recovery and well-being depends on how well a patient heals. Anxiety and distress exacerbates the illness, but a nurse with good healing powers has the ability to listen and be compassionate and caring, yet strong, and able to interpret all of our medical necessities into their care. And a nurse with good healing powers will be able to help the patient adapt and follow instructions to be more compliant, aiding in their healing process.
Oh, that's a really interesting response to our superhero question, because you're not talking about a magical superpower. You're talking about having the characteristics of being a healer to help patients recover. So that's very unique. That's a great response, Lupe. Thank you.
Lupe, why don't you tell our listeners how your passion for healthcare began?
Well, actually, I think all nurses or anyone in the healthcare field has a story and has an instance and an aha moment that says, that's where I have to, that's my road. That's what I want to do for a living. I believe that most of us go into the healthcare field to help people. And usually it's because we realized that we were good at it. For me, my father had cancer. when I was 18. And so his road and his diagnosis with cancer led me to see the difference that one nurse can make in a patient's life. And I wanted to be that one nurse.
Lupe, we truly appreciate you sharing your personal story about your father. The care he was receiving during his cancer treatment obviously had a huge impact on you.
Yes, thanks for sharing that. Now, Lupe, I understand that you went and obtained your associate degree in nursing from East LA College and started your career as a surgical tech. Could you describe going through that process and how you got your start to your career?
Thank you, Martin, for that question. I think with this pandemic, a lot of people are questioning whether their job is essential or they're looking at healthcare workers as a different pathway now, because we were able to help a lot of people that never thought of us as essential before. When I was young, I began my career as an OR tech, as a surgical technologist, and that was back then in the 1800s when I went to school, it was an 18-month course, and it was out of a program in downtown LA. That school is no longer there. It was 1 year of didactic and academics. Then it was 6 months of externship. We actually went into an OR, and as OR tech students, that was a very powerful time in my life because I was green. I mean, we know what we know in school. That's all we know. But once you get inside there and you actually go into surgery, I mean, we've all read in the books that the gallbladder is green. However, when you actually hold it in your hand, then it's when it hits that the gallbladder is actually green. So I started off there in Los Angeles at a trade tech school, 18 months. And then I went on to obtain my associate's degree in nursing at East Los Angeles College. I worked my way through my associate's degree, working full-time as a surgical tech. So that assisted me in the clinical portion because I worked side by side with the rest of the healthcare field. Respiratory therapists, RNs, LVNs, CNAs, everyone is intricate. Everyone is a big piece of a big puzzle. And without one of those little pieces, we're not whole. So working side by side with everyone else made me realize I wanted to continue my nursing career.
And continue your nursing career you did. But Lupe, it must have been challenging going to work and school at the same time.
It was very challenging because I had young kids. So I would put them to sleep and then I would start studying. I would begin studying.
And Lupe, like even from back then to now, that's something that still exists for likely most of our listeners who are actually still in school. So do you have any tips of how somebody could go through that? I know it's going to be challenging being someone that's going full-time and going to school, working full-time, going to school, but in your situation too, had young kids.
I did have young kids. And I do think that anyone who goes to school and holds even a part-time job, it's hard, but they're going to be very successful. Now, the good part of that, I know it's hard. They struggle every day. However, their family is seeing that, and the kids are seeing their mom or dad or stepmom or dad or uncle or grandparent, whoever the parent is, they're going to see them better themselves and struggle for the better of the family. And that instills good morals in the kids. And they also learn that if mom can do it, I can do it. And hopefully they remember that. And then they'll respect everyone or the parents a little bit more later on.
Clearly you went through, you did the grind, and look at, we're here today interviewing you.
Nice. I hope that everyone does continue with their educational goals. And a lot of people stop because they think it's going to take too long. However, they don't realize that those years are going to come whether they do something about it or not.
And so that actually leads us off pretty well. You know, you did some further education after your associate's degree. Why don't you talk about that and where you got those degrees and how that all shaped up?
I obtained my associate's degree in nursing from East Los Angeles College because I was born and raised in East Los Angeles. And then I went on to continue my bachelor's degree at the University of Phoenix. Once I received my University of Phoenix degree, my BSN, I was able to now go into more management roles. And after I was in management for a little while, I realized that I had a knack for business development. I could see something and I could visualize how we could improve on it, especially with equipment and unit departments or hospitals. I assisted with a lot of the Medicare and state accreditations. And so that taught me a lot about state rules, regulations, and laws. So therefore, I went on to obtain my master's in business administration at Pepperdine University. And I didn't just obtain my MBA. My degree is an executive MBA. So it's an EMBA because I was already doing the management portion and the business part. And I just didn't know the legal terms. So I actually qualified for an EMBA at Pepperdine University.
Could you tell our listeners how you started getting into those management roles? Like, what are some of the practical things you can do to, if you're interested in being a manager, like, how did you get your start there?
I became a manager because I was a floor nurse, a staff nurse in a surgical center and at a community hospital. One day I received a call that my director of nurses was in an accident and that the next day that office was mine. So I was in it quite by accident. I was just in the right place at the right time. And therefore I went into her office and I noticed that there was a CDPH survey and it was we were due to be resurveyed. And I didn't see anything done. So I called higher management and they assisted me through the process. That was my very first Joint Commission and DHS survey combined. And they assisted me. So they helped me find the answers. So once I found the answers to that survey and we came out of it with glowing reviews, not one deficiency, higher administration called me into the office and said, since you did so well for your unit, I now need you to help me with the hospital. So that was my opportunity to get into management. My advice for anyone who wants to get into management is to know your unit, know your job, listen to your staff, your coworkers, your physicians, and try to assist in improving the quality of patient care in any way that you can. You can always start by just reading the policy and procedures for the unit. That is your bread and butter, all your laws and standards and guidelines that will help you know not just what's right, but what's wrong. So it's always hard to know absolutely every single rule and regulation. However, once you've read it once, you can now tell what's incorrect. So in order to start reading your rules and regulations that are in your policy and procedures. If you really find them interesting and you have a knack for fixing things, then you can go on to the Joint Commission standards, the CMS guidelines, and any kind of certification course that you can learn from. That is the way to improve your knowledge and to find your knack in what division it is that you want to proceed in. Because there's different types of management.
Wow, that's some terrific information there, Lupe. And I know you're actually sounding very modest for yourself. You're talking about having a knack for fixing things, and you got lucky at the right place at the right time. But what also I'm hearing here is you really took the initiative to go out there and make sure that you learned your unit, you learned to improve yourself. So when the opportunity came, you were ready.
I was ready. I didn't know I was ready, but I guess others did see that skill in me. After that, a couple of surgeons approached me to help them start a surgical center. So I did assist them. It was very scary because it was something I had never done, but I knew that we could do it and we could do it correctly if we knew all the rules and regulations. So once again, I went back and read. I learned all the rules and regulations, and then we went scouting for a site and we built that surgery center from the ground up. We were able to build it, as we used to say, it came to fruition from decision to incision. We did it from the beginning to end.
So just to give our listeners a sense, when you started getting into management, how many years had you been a nurse, or how many years had you been working in healthcare by that point?
Well, I had been an OR tech for 5 years, and I was a nurse, an RN, for 4 years.
Okay, so you're relatively junior. I mean, that's only, you'd only been a nurse for 4 years,
Exactly.
The lesson that we take from this is that you shouldn't let your years dictate, how ambitious you are in your role. I think, you've been able to prove a lot and to show that you're capable in a very short period of time, relatively speaking.
Exactly. There are some born leaders, and then there are leaders that are made. But I think everyone has the capability to manage. Management and leadership is a learned skill. It also takes a lot of experience, not years-wise, but more substance-wise. It depends on your unit and depends on how active you are in participating. You can become part of the committees, subcommittees, quality committees. You can always volunteer to assist with accreditations. And those are all little things that make a great leader. Substance.
All that effort, all that work just adds up over time.
It does. And also knowing what you would want if you were in that bed. How would you want to be treated?
Always thinking about the patients.
Always think about the patients. And that is the one thing that being a good nurse and a good leader needs to remember. This is not about our paycheck. This is about our patient. This is a life. And our decisions can kill someone. And that someone has family and friends.
No, absolutely. Yeah, that thing definitely as a healthcare professional and you direct care, I know your decisions every day, especially in the management side, it really impacts your organization entirely. And of course, specifically these individuals, your patients and their families.
Yes.
So thank you for sharing that, Lupe.
You're welcome.
Getting back to your educational and career arc here, you went and opened at that surgical center from top to bottom. Then where did you go after that?
After that, word got out that I was able to reorganize, restructure a unit or an entire facility. So I started going to different hospitals. I was recruited to go into different hospitals and open up new surgical centers and to reorganize and repurpose a unit, a single unit in a hospital. And then finally, I was able to meet up with my current bosses who also saw my abilities, and we partnered in a new hospital venture.
Mm-hmm. And you joined them as the chief nursing officer at both subsequent ventures. Mm-hmm.
Yes. What I do is I go in and assess and evaluate and restructure, reorganize the whole facility so that it can become financially feasible and provide quality patient care for the community at the same time.
Yeah, that's the thing in healthcare, right? It's as large as it is, especially in these communities, is quite small. And that's why you say your name got out there, that you have such a skill set that's very unique and very valuable to potential organizations looking to start up or really turn around an operation.
Yes.
That leads us to another sort of question. I think a lot of people are probably wondering, I know you've had a number of different roles. And so tell us, Lupe, what does a typical day as Chief Nursing Officer at LA Downtown Medical Center look like?
A typical day for a CNO, not just at LA Downtown Medical Center, but I think for anyone in management, never ends. It's continuous. It's a 24/7 role and responsibility. So, but my day typically begins about 5 a.m. with the patient census, and that starts coming in through computer. So then we start checking our emails. And then once we get into the office, we start juggling absolutely every single thing that has occurred over the last shift. So we start taking care of all the challenges and concerns that occur or that are brought to our attention during our morning rounds. And then it's also continued with meetings and committees, and it just doesn't end. It's every day, all day long. And because healthcare and a hospital setting is 24 hours, the concerns and the challenges never end.
Yeah, like you said, it's not typical in your position and you're always running around. And it seems like even though it's not typical, one thing consistent is your skill set with utilizing your communication whether it's physicians, leadership, team, or staff. It seems like that's something that's key to your success daily and to your career here. So given your past experience, like what advice do you have for nurses now or nursing staff to communicate with their own management teams?
The management team is one of the biggest and most important part of a hospital. They lead by example. So they need to be responsible for all the entire department or unit that they run, but they also have to be accountable for the actions. They need to remember that what we're doing is for the patient, always for the patient. Yes, healthcare is a business, and without the business, we can't take care of the patients. But we can provide quality patient care, always strive to provide quality patient care in the most ethical and responsible manner, and everything will fall into place.
That makes sense, Lupe. Do you have any other tips for those nurses or other healthcare professionals who want to get on the radar or get noticed by management?
Yes, absolutely. Speak to your manager. Let them know that you've noticed certain aspects are not up to par, or certain activities can be conducted in a different manner to improve the quality of patient care. And that will definitely get someone noticed. Someone who speaks up, especially for their patient or for their coworkers, and always want to do better for the institute that they work for, will always be noticed and remembered.
So it sounds like a combination of speaking up, a combination of being laser focused about patient care, about trying things differently, and taking care of your colleagues. I think those are all very practical, good pieces of advice. So similarly to that, our listeners would love to know, so what's the best piece of advice you've ever been given?
Well, actually, Martin, the advice that was given to me actually started off as a criticism. The administrator of a community hospital that I was a staff nurse at would not even listen to us when we said that we needed upgraded equipment. He only told us that there was no money for the hospital. He actually came to me one day and said that if I wanted to make decisions, I needed to go to school, because nurses take orders. They don't make them. So that's when I said, I'll be back. And I went to school.
Wow, that's a pretty harsh thing to say. And I think we can all agree that nurses don't just take orders. But putting that aside, furthering one's education in a thoughtful, focused way is definitely a tried and tested way to get ahead in life. And, what's the worst piece of advice you've ever been given, Lupe?
The worst piece of advice was for me to not pursue the nursing path that I wanted to go into. I was at a community college before I started my formal nursing education, and I went in to inquire about the program. The actual counselor told me that since I was Hispanic, Mexican, that I would not make it as a registered nurse, and that I should go into a lower level educational field, because I could not make it. I didn't have what it took, because the chances are for a Mexican to finish nursing school is very low.
Wow, that's terrible. This just reflects on the strength of your character, Lupe. In spite of this blatant racial discrimination, and no less from your career counselor, someone who should have been trained to encourage rather than discourage you, you were able to persevere. And I have a follow-up question to that. Do you have any suggestions for our listeners who are still trying to develop that same sort of confidence within themselves?
I think that everyone has it within themselves to be great nurses or a great healthcare worker. Not necessarily a CNO, but every single person in the healthcare industry is very important. A patient will always recognize someone who has that ability and will say thank you. If you are thinking about going into the healthcare field or are in the healthcare field and want to progress further, don't give up. Always know who you are, and just always remember that what we're doing is for the patient, and good things will happen.
That is an excellent reminder, Lupe. Yes, everyone has it within themselves to be a great healthcare worker. It's kind of like control what you could control. Do the right things and push forward. And like you said, good things will happen. On that note, Lupe, how do you stay mentally and physically healthy as best as possible?
It is hard to stay mentally and physically healthy, especially on a day when you lose 3 or 4 patients, and especially with this COVID going around right now. So there's so much insecurity, misinformation. There's a lot of unknowns still around. But with all of that going on, there's always your home life. So a good work and home balance is always key. There's a lot of meditation and prayer that goes on. But I think what helps me are my 2 little grandsons. They are my life, and they keep me very humble, because even though I can think I know everything, they are the first ones to point out I don't know anything.
Well, shout out to your 2 grandsons. Hopefully they'll listen to this and know how important they are to you.
I hope they go into the healthcare field also.
I hope so too. In closing, Lupe, is there anything that you'd like to say or to wish to our listeners?
I hope everyone follows their dreams. Healthcare is a wonderful field to go into. Any position in a hospital or in the healthcare field is important. No matter how small they may think it is or how big, everyone is a piece of a big puzzle. And without that one piece, we're not whole, we're not complete, and the patient will not get the best care if we're not at our best.
What a great episode, Martin. And we should note that after we recorded this episode, Lupe left LA Downtown Medical Center, and we wish her all the best. And now it's time for the handover.
All right, folks, here are top takeaways from this episode. Education, education, education. Take every opportunity to advance your education because it will undoubtedly unlock opportunities previously unavailable to you. Always keep learning on your job. Understand your role inside and out, which could mean reading and improving the policies and procedures of your facility or your department. Aim to improve the quality of patient care however you can. Speak up early and speak up often. This will help you better connect with your nursing management team. Don't let your youth or limited years spent as a nurse limit your ambition. If you don't believe you have what it takes to take on a new challenge, nobody will. And finally, management and leadership are skills that anyone can learn.
Wow, what a great handover there, Martin. And you, our Care Heroes, want to thank you for listening. And don't forget to rate our podcast on your favorite podcast app. And if you want a shout out on a future episode, visit careheropodcast.com. Send us your name, role, and location for a shout out on a future episode.
And just a reminder, that's on the Contact Us page. All right, Gerard, now it's time for some shout outs.
Yes, we want to give a shout out to Bruce, an RN from Glendale, California, Alex, an MD from Los Angeles, California, and Benjamin, a lab tech from Burnaby, Canada. All right, that's it, folks. We'll be back soon. Same Care Hero time, same Care Hero channel.
Thanks for listening to Care Hero Podcast. Don't miss out on future content. Hit subscribe and rate us in your favorite podcast app. Also, remember to visit us at careheropodcast.com to send us your feedback, sign up for the newsletter, and nominate a Care Hero to be interviewed on a future episode.